Good afternoon, I'm Toronto plastic surgeon Dr. Marc Dupéry. I would like today to discuss the medical condition called hyperhidrosis or heavy sweating. Heavy sweating can be quite socially and physically disabling to people. We've all shaken hands of people who sweat a lot. We've all seen people writing on a desk with underarm wet area. Now, there are multiple treatments that are offered over-the-counter topical treatments. Many are aluminum-based, many are irritating to the skin. So when patients are not responding to the topical treatment, the next level up is Botox. Now, patients are asking me again this morning, how does Botox work for heavy sweating? So if you come a little bit closer here, we know from many years ago that Botox works between the nerve and a muscle fiber. This is how we've learned how to treat wrinkles. Botox sits, this is the blue dots here, sits between the nerve and the muscle and blocks the communication between the two, and the muscle will not contract and therefore there will be no wrinkles. That's how Botox cosmetic was discovered. Now, it happens that what the nerve uses to talk to the muscle is called acetylcholine. It happens that the same, we call it neuromodulator, the same acetylcholine is the responsible neuromodulator to activate a sweat gland to make sweats. So Botox sits in the same idea, same fashion, sits between the nerve and the sweat gland, prevents the communication between the two, and the sweat gland remains silent. Now, this is a common treatment we do for the underarm area, but we also do it for the palms and for the soles in people suffering from hyperhidrosis. So if you come a little bit closer here, I have a young male who has a moderate amount of hyperhidrosis, but enough that it ruins his shirts. So we do this treatment every 9 to 12 months. So the average is 6 to 12 where it will last, and in his condition it's about every 9 months. So if you come a bit closer, we can do a starch test that will tell us exactly where the sweat glands are. It's usually the hair-bearing part with an extension into the depression here and into the creases of the arm. I will do a few injections for demonstration. I am in the dermis, so it's very superficial compared to Botox for wrinkles. I go right into the dermis, and he will have 30-40 little welts like a mosquito bites for a day or two, and I will continue all through the axillary or underarm dome. We put topical anesthetic cream. It's a tiny needle, but it's a lot of little tiny injections, so we normally put topical anesthetic cream to make the experience a little bit more pleasant. The result take 2 to 5 days to kick in, and again it will last on average 6 to 12 months. So this is treatment in Toronto of hyperhidrosis or heavy sweating. I'd like to add in conclusion that many drug plans will cover at least part of the medication. This is a very successful treatment, and this is Dr. Marc Dupéry, Toronto plastic surgeon. Thank you.